So I'm going to explain fetal circulation as best as I can. I drew this diagram. Hopefully it makes sense. So I'm going to walk us through what everything means, okay? This is a placenta, okay? And the umbilical cord is directly attached to the baby's inferior vena cava. This is the inferior vena cava. Umbilical cord is directly connected to the baby inferior vena cava, okay? This blue is fluid-filled lungs, both of them. They're filled with fluid, okay? Why are they filled with fluid? Because the baby is breathing in amniotic fluid, okay? Fluid-filled lungs are here. This is obviously the heart, right atrium, left atrium, right ventricle, left ventricle. So I put this orange separation here, okay? But in a fetal heart, there's no septum at the top. So the right atrium is directly connected to the left atrium. There's no septum here. And that, I keep getting interrupted. Okay. So there's no septum here. There's an opening called foramen ovale. You can remember that foramen ovale connects the RA to the LA, so blood doesn't have to flow down here, okay? So blood's gonna come here. It doesn't have to flow down here. There's no reason to. So it goes from here straight over, okay? FO, the O, we can say it's an opening, okay? Foramen ovale. Then, after it goes through this opening, this is deoxygenated blood. The baby doesn't need any deoxygenated blood. She already used it. She's tired of it. She's ready to send it back to mom to get some more ammo, more oxygen. So then this blood goes through the pulmonary artery. This blue line, this is the pulmonary artery. You can see that it leads to the lungs. So now, this is very different from an adult heart. We have a ductus arteriosus. This is a bridge. This black, I did it in black, is a bridge. It connects the pulmonary artery to the aorta. The ductus arteriosus connects the pulmonary artery to the aorta. And then it goes to oxygen-poor blood, pumps to the umbilical cord arteries to mommy back for more oxygen. I'll say it again. So deoxygenated blood comes from superior, goes over the opening into the pulmonary artery, over the bridge into the aorta, back to mommy. Follow this line. Back to mommy for some more. Sorry, I can't put the phone down to video because it keeps cutting off. Anyways, so now where does the oxygen-rich blood come from? Placenta, oxygenated. It goes through the inferior, up the aorta. Oxygen-rich goes to the baby. So now in the aorta, there's two paths. You can see one here, one here. It's like a blue and black line. Blue and black is oxygen poor. The black is oxygen rich. So that is the difference. We have this ductus arteriosus. It connects those two, pulmonary artery and aorta. Another difference is this opening. Blood comes through here and crosses over. I forgot about the third duct, which is called the ductus venosus, DV. And what this does, it bypasses the liver. What is the function of the liver? Just think for a second. The function of the liver is to filter the blood, to, remove bilirubin, all of that. So what this oxygenated blood is coming through, it doesn't need to flow in there. This is kind of like a gate saying don't enter. So it's telling you to take everything straight to the inferior vena cava. Ductus venosus, it bypasses blood flow to the liver. Baby doesn't need to filter blood in the liver because the mommy's gonna remove her waste. Okay, so ductus venosus connects the umbilical vein to the inferior vena cava. Umbilical vein, inferior vena cava. Stop sign, no incher.